Welcome to the first in a small series of informational roundtables. The purpose of this series is to help pass along relevant information to existing and newly admitted nursing students. In today's chat, we will address clinical requirements. I'd like to take this time to introduce Ms. Kelly Reed and Mr. Dirk Singleton. Welcome.
Hello.
Hi.
First question I have, are the clinical requirements for students similar to those of the nurse who's out in practice?
Yes, as practicing RNs, it is required that you maintain a current non-expired CPR card. In addition to the BLS for healthcare providers, you also have to have ACLS, which is Advanced Cardiovascular Life Support, or the PALS, which is Pediatric Advanced Life Support. Some facilities require that you have both of these, and the certificates are good for 2 years and must be renewed in the month of expiration prior to the last date of the month.
Okay, what happens, if anything, if that certification expires?
You are not allowed to clock in and work until you get the certification cards turned in to HR or to whoever tracks your requirements.
Okay, good information. What other requirements, if any, are expected to have to be kept up to date?
Well, I appreciate you asking. So you have your annual TB screening and fit testing. These are two that have to be maintained both while enrolled in the nursing program and in the workplace. I know that students can either submit a TB screening performed by a healthcare provider or have the PPD 1 or 2 step completed. The blood test, quantiferon TB Gold, T-Spot are also acceptable now, and what many hospitals have their employees do. If you have had a recent negative chest x-ray due to a history of positive skin test, I know that can be used as well. I know personally that can be used as well. And these are something, you want to stay on top of this. You want to be responsible for it yourself.
Could you explain for us what a fit test is and what that means? Maybe just summarize.
Yeah, absolutely. And this is the perfect time to talk about fit testing because essentially what fit testing is doing, it is, without reading my script, I'm just going to talk from the hip on this. So fit testing is a way to get a mask on your face that seals off airborne particles, which is, droplet is, it's stopped much easier than something airborne. Something airborne can be in the air for a certain amount of time. Sometimes it's not very long. Sometimes it's for minutes or longer. And the idea is to seal that on your face in such a way that you can do your job, you can go about your work, and not have to worry about breathing that. So essentially it's a process of testing to make sure that that seal is achieved while wearing an N95 particulate mask specifically. That's what we would use for you, or what they would use in the facility. There are several steps in the process. You will schedule an appointment with one of us, and we will walk you through it. There's some kind of funny parts. You got to sing a song, do a dance, which amuses us to no end, probably you a little less. But we've all had to do it, right? Some important things to know ahead of time. If you have asthma, please bring your rescue inhaler with you to your appointment. We'll ask you about that, but the truth is you can't even try it if you don't have your inhaler with you, if you have asthma, okay? This one applies to me, man. I remember the days. I hated it. So if you're a male and have facial hair, you must come clean shaven to the appointment so that you can be properly fitted. As you can see, I don't like clean shaven. 2 years in a row, completely shaved off. Very unhappy time. But that's what you have to do. And if I worked in the hospital now, I would be completely clean shaven because I have to have that mask sealed perfectly. So if you are a male, you don't just have to shave it to get it to fit in the lab when we're testing you. You have to keep it shaved when you're in clinical if you're in an exposed situation. which is what everyone is right now with COVID, of course. And 3, don't have anything to eat or drink other than water for at least 15 minutes before your appointment. That includes gum and breath mints.
That's good information. And there'll be another video link with more information on fit tests posted in this cohort's news items so that they can look into it a little more in depth. But that gives a really good overview. Thank you for that. What other clinical requirements do students enrolled in the nursing program have to complete annually?
Yeah, so another requirement that students have to complete is a general orientation to TCPS, and that is the Tennessee Clinical Placement System. And it includes a basic orientation, these modules that must be completed each academic year, so that's basic. And after completing the general orientation of nursing and successfully passing the quizzes, yes, you're always tested on everything because you have to know it, not just read it. You upload these into the drop boxes designated for each one required. Sometimes students select the wrong orientation type, so it is important to look for the one listed as nursing, physicians, physician assistant, and related faculty. So also, sometimes there are specific requirements with TPS for a facility as well. And in that case, you'd have to complete those and upload it appropriately as well.
Yeah, I think that has been one of the biggest things I've seen over my time at Cleveland State is students spend all this time completing the wrong general orientation, and then they have to go spend more time doing the right one. So yeah, that's a really good one to bring out. Are there any other tips or reminders that you guys have for the new nursing students related to clinical requirements? Anything from experience? You're both Cleveland State grads, right?
Yeah, I definitely have at least one tip. It applies very much to clinical requirements, but really it applies to everything in nursing school. Be responsible for it. Don't expect someone else to always remind you of what you need to do. Do it early. Do it ahead of time. Get it out of the way so that you can focus on the things that you may be struggling with a little bit more, and you're always prepared for those clinical and those test situations. So get it done.
Yep.
Can not having your clinical requirements perhaps impact your ability to go to clinical? Do you know if that's something?
If I'm not mistaken, I don't think you can actually go to clinical if you don't have them. If a facility specifically requires you to have these things done and you have not done them, you haven't fulfilled the contract, therefore you cannot participate. Just like if you didn't have your, if you're a working nurse and didn't have your CPR updated, you can't come to work. Same scenario.
Yeah, that's a good point, and I agree that those are the requirements, you know, that we've agreed to as a school, that all of our students, clinical faculty, full-time faculty who are going to clinical, even our accreditation bodies actually say you have to maintain these records that these things are done each required term. So yeah, you're absolutely right on that. Anything else you want to add before we close?
Nope, I think that about covers it.
Just one last little thing, add right on to the end of what I just said and what Dr. Franklin just said. You can't think of all of these requirements as one more little thing you have to do. You're in the program. This is part of the program. This is part of what everyone going through the program has to go through. We went through it. You'll go through it. It's just part of the program. So just embrace it, get it done, and move on.
Good tips and good information. Thank you for this first roundtable chat. We look forward to meeting you again soon.
Bye.
Have a good day.
Bye.